Hi, my name is Daniela Parrales and I'm going to talk about the purple urine after catheterization. The definition. Purple urine bag syndromes, or PUBs, occurs when urinary catheters and bags become a purple color. This occurs more in women and it's associated with a bacterial urinary infection that produces sulfatase and phosphatase.
A woman was admitted to a hospital after having a stroke, but while she was there, something really strange happened. Her pee turned purple. This might seem really unusual, and it is, but it's less unusual than you think. It's common enough that doctors actually have a term for it, and it's called purple urinary bag syndrome, or PUBS. PUBS usually occurs when someone's had a catheter inside them for an extended period of time, as you might at a hospital. The bag that collects the urine ends up having bacteria that shouldn't be there, in addition to the elements usually found in urine. These mix to turn it purple. In the case of our patient, the bacteria Klebsiella pneumoniae was found in her urine, which can break down a common compound found in our foods called tryptophan. You might know tryptophan from Thanksgiving turkey. Supposedly it makes you sleepy, but it can also be found in beans, eggs, nuts, and a bunch of other foods. So when tryptophan breaks down in the body, it ends up being turned into this chemical called indoxyl sulfate, which the bacteria then take and split into two parts, one of which is red, the other of which is blue. Together, in the urinary bag, they turn purple. PUBS can sometimes indicate something awful like an infection, but luckily for our patient, she just had to rehydrate for a few days, and her pee went back to normal.
Application in medicine. This condition is often associated with urinary tract infection. Discoloration of the urine bag is due to the presence of indigo and indirubin pigments, which precipitate and react with the synthetic materials of the catheters and urinary bag. The pathogenesis of the purple urine bag syndrome is due to the metabolism of tryptophan by bacteria to indole and later convert to the indican in the liver. This is excreted and broken down in the urine by bacteria possessing one or both enzymes, sulfatase and phosphatase, that metabolize this pigment to indirubin and indigo in an alkaline environment, urine.
Hi, Dr. Aaron Spitz here, America's favorite penis doctor, and today I want to talk to you about a very colorful topic, and that's urine. Yes, urine. The color of your urine can say a lot about your health, and there's a whole rainbow of colors that might occur. Most of them are okay, but some of them are definitely not. So let's start on one end of the spectrum, and that's clear. Clear might mean that you're drinking too much. Is that possible? Yes, it is. People can overhydrate, and a good rule of thumb is to just drink to your thirst. Now, if you're a kidney stone former, good idea to try to shoot for 2 or more liters of water a day, but otherwise, drink to your thirst. You want your urine to be a nice pale yellow. That's a good sign of well hydration. Solid yellow is okay. Dark yellow, you're probably not drinking enough and should hydrate more. Now, if your urine starts to look honey-colored, amber, that could be a problem with your liver or gallbladder, because that could be a sign of bile backing up and then overflowing into your blood and out into your urine. Red is danger because red usually means blood, and brown is danger too because that means old blood. Occasionally red is due to eating beets, but in most cases get on in to see your doctor because you got to rule out something that's putting blood in your urine, anywhere from the kidneys to the ureters to the bladder. Could be cancer, could be stone, could be kidney disease. Anyway, got to get it checked out. What about fizzy urine? Well, now and then that's okay, but if you've got consistent bubbly urine, that could be gas from an infection or from a fistula, a connection to your intestinal tract. And sometimes you see that with certain inflammatory conditions or infections or even cancers of the colon. Now, if your urine is green or bluish, that's really rare, but occasionally that can be due to an unusual urinary tract infection or a side effect of a particular medication. But again, get that checked out. What about purple urine? Well, there is no purple urine. So you might in fact be on drugs, but it's not from drugs. At any rate, pay close attention to your urine. If you see something unusual, get it checked out. Shoot for that nice pale urine color, and that'll keep you in good health. Anyway, I hope this answers those pressing questions about urine. Be sure to continue to tune in and check me out on Facebook, LinkedIn, and Twitter.
Pros and cons. Pros, it's fairly simple, it's safe to use, it's inexpensive, and promotes independence. And the cons, you can have urinary tract infection, pain, scrotal complication, urethral adverse events.
Catheterization allows urine to drain freely from the bladder for collection. In your role, you may be required to change urinary catheters. But in order to do this, you need appropriate knowledge of the types of catheters and routes of catheterization. A urinary catheter is a hollow tube inserted into the bladder to drain urine. Urinary catheterization is the passage of a urinary catheter into the bladder via the urethra, which is called urethral or indwelling catheterization, or through the abdominal wall. This is called suprapubic catheterization. By following the correct procedures for changing urinary catheters and recognising how to monitor and troubleshoot, you can help preserve the comfort and dignity of the person in your care.
Issue apply in Ecuador. The purple urine bag syndrome is a fairly unknown condition which leads to marked change in the urine bag system due to bacterial metabolisms. In Latin America, there is a great lack of statistical data, therefore it's very difficult to know the prevalence and incidence of this disease.
Catheter-associated urinary tract infection, or CAUTI as it's often referred to, is one of the most common hospital-acquired infections, and it can also lead to certain complications, including increasing length of stay for patients. It can lead to pain, discomfort, and actually to death in some patients. CAUTI and the use of catheters is one of those areas where we really need engagement by nurses, physicians, and families. Over the past several years, we've done work with the Health Research and Educational Trust through an HRQ-funded project to spread practices to prevent catheter-associated urinary tract infection in hospital units. We've done work both locally and regionally within the state of Michigan, and now taken that work nationally across the United States. We developed a lot of strategies and a toolkit to help hospitals with their quality improvement and catheter-associated urinary tract infection prevention activities. And so this toolkit really focused on a couple of different issues. One of the aspects was to look at various technical issues that we can use in our prevention work, focusing on whether the catheter is needed or whether an alternative could be used, making sure that when we do have to insert a catheter, it's done appropriately, and making sure it gets removed in a timely fashion. We also worked with them to collect data and use that data to understand where their improvement efforts were working or not. And there was also a big focus on culture within hospitals and how we can, as hospital providers, as nurses and physicians, work together to focus on this issue. So the outcome of this very large-scale collaborative was a reduction in catheter-associated urinary tract infection rates. There's also a reduction in catheter use, specifically in units that are not ICU. So these are the medical surgical units. We did not see a reduction, however, in the intensive care unit setting. The other outcome of this initiative was a reduction in catheter use, also again in those units outside of the intensive care. So perhaps a little bit more work that needs to be done in the intensive care setting. Sometimes I think as healthcare professionals we see a lot of bad news about the things that are happening to patients, and in this case what we saw really was good news in the fact that we could reduce catheter use and catheter-associated urinary tract infection rates for patients. And so this really is, I think, a success story, and that healthcare professionals and the hospitals that participated in the units really should be congratulated. For hospitals that were not part of this activity, there are tools that are available both on the AHRQ website, so the toolkit that was provided for the hospitals, and a lot of the materials that were provided for the hospitals that participated in the collaborative are available. There's also materials on catheterout.org, which is another website that provides a lot of information about how to prevent CAUTI, as well as some of the tools that were used as part of this effort.
And the conclusion, we found that PUPS was more likely associated with the female gender, alkaline urine, constipation, the use of a plastic urinary catheter, and certain bacteria such as Escherichia coli and Klebsiella pneumonia.
Urinary bag syndrome, and it first appeared in medical literature back in 1978. And it's fascinating to see the urine because that isn't some subtle purple. That is a very radiant violet color.
I mean, like grape juice.
Like grape juice. And turns out that this particular woman had a certain microbe in her urinary tract that interacted with a food byproduct. And just so turns out that when this whole thing happened, they were able to break down, it's called indoxyl sulfate, and it's broken down in the body due to the microbe into indigo and into rubin, which basically blue and red, which creates this purple color. So it's basically a metabolic product of a bacterial reaction from food that she had been eating.